I'm delighted to welcome you to this course on control of diabetic retinopathy. My name is Dr. Nyawira Mwangi. I am Principal Lecturer at the Kenya Medical Training College in Nairobi, Kenya. I'm also a Research Fellow at the London School of Hygiene and Tropical Medicine in London. My work focuses on the control of diabetic retinopathy. This course has been developed through the contribution of various people. We want to thank them for making this contribution. We are focusing on diabetic retinopathy because it's a growing problem of public health importance. It affects people who are living with diabetes, and it causes avoidable visual impairment and blindness. All the people living with diabetes are at risk of this condition, and once they lose their vision, there's an impact on education, on social roles, on economic roles, and many other aspects of life. Therefore, we need to invest in the control of diabetic retinopathy. Research has shown us the link between diabetes and diabetic retinopathy. If we look at people who are living with diabetes in the early years, for example at 3 years, about 10% of them will have some element of diabetic retinopathy. This proportion increases progressively with the duration of diabetes, such that at 15 years of living with diabetes, about 80% of these people already have some diabetic retinopathy. Now, they may not know that they have diabetic retinopathy because in the early stages, this disease has no symptoms. The vision remains unaffected, although the condition is becoming worse. In the advanced stages, this is when visual impairment occurs and in blindness results. On this course, the target learners are all persons with an interest in diabetes eye care services. This could be healthcare providers who are already working with people with diabetes or with people with eye problems. It could be educators and students on training programs in relation to blindness or in relation to diabetes or to eye problems. It could be public health specialists with an interest in visual impairment. It could be health system specialists who are interested in strengthening the health system for diabetes or diabetic retinopathy. It could be policymakers who make decisions about care for diabetes and diabetic retinopathy, people implementing programs in these areas, and also users of the diabetes eye care services. The aim of the course is to improve the knowledge of the learners so that we can all contribute to the prevention of visual impairment and blindness from this condition, which we will now refer to as DR. At the end of the course, we expect that you will be able to, 1, understand the risk of diabetic retinopathy so that you know what factors influence this risk. 2, understand the role of the patient in the control of diabetic retinopathy, and this is a central role that we need to empower the patient to participate actively. You will also understand the role of the healthcare provider in ensuring that we have good outcomes, for example, visual outcomes, that people with diabetes or diabetic retinopathy do not go blind from this condition. You will also understand how we can strengthen the health system so that we prevent more people from going blind in our population. These are the 4 modules that we will study in the course, and we will use videos, we will use text, images, illustrations, we will have links to other materials, and we will also reflect from our own experiences in order to enhance learning. This course is licensed under the Creative Commons license for attribution, non-commercial use, and share alike. The materials that are downloadable can be used, reused, and shared under the same license. This course has been developed through the input of various experts who are in various institutions, in various cities, and in various countries. And in this course, you will access their expertise by participating and learning, and we thank them for participating. We welcome you to the course, and we hope it will be a useful learning experience.